Yeah, so Cadila, you know, is India's first pharmaceutical manufacturing company, established in 1951. Over these years, last 6.5 decades, we have been sort of, in fact, Cadila itself was born out of a social cause. In the sense, our founder chairman Indravadan Modi lost a lot of his near and dear ones at very early age itself. In fact, he was brought up by his grandparents because he lost both his parents when he was just around tender age of 5-6 years. And since then, he was brought up by his grandparents. And once he graduated, he incidentally is also India's first pharmacologist. And instead of taking up jobs overseas, he decided to establish a pharmaceutical company. His life-consuming mission was to make high-quality, affordable medicines. And because he lost a lot of near and dear ones, those days, all these dreaded diseases like cancer and other ailments which he lost a lot of his relatives to, were not even, they didn't even have medications for it. And he was born in a very small village in Hansot, in Bharuch district, which was very impoverished. So he, in 1985, to be precise, around 35 years back, he established this trust called Kakaba and Kalbud Trust. Basically, it was established to create a rural hospital in the neighborhood of Hansot. There was no primary healthcare center there, so he established this hospital. Today, it is state-of-the-art 100-bed hospital, and most of our CSR activities that we have initiated and have been doing it since 1985 revolves around health and hygiene and rural development. So, so for us, it's a way of life. So CSR activities, we have not stumbled on CSR activities because it's mandatory now. We have been doing it since day one, since 1950s, and in 1985 we established this hospital. Primarily, our CSR activities were revolving around healthcare, health and hygiene, and providing affordable medicines. But over the last decade, we are also diversified into other related needs of the neighborhood. Our idea was, that we are in the society, we should be contributing to at least our neighborhood, and after January 2016, when the India also was signatory to the UN Sustainable Development Goals, we thought we should also relate our CSR activities to these 17 sustainable goals which has been enlisted in the UN Charter Agenda for Sustainable Development. So so most of the activities that we are doing, it has some connection or relates to some of these 169 sustainable targets that UN has enumerated to be achieved by 2030. So so for example, healthcare, yes, we are established and we do a lot of work. This has become Gujarat's most visible outreach hospital for CSR activities. A lot of other big corporates, like Ambuja Cements, Asian Paints, ONGC, they run these medical vans, medical ambulances. They go to thousands of villages across length and breadth of Gujarat, and anybody who requires aftercare or additional critical care, they are referred to this hospital. So as a result, on a daily basis, this hospital now has patients of around 200. They have outpatient of around 200 to 250 people who come to this hospital for some treatment or other. We do all kinds of like we do on a regular basis dialysis, kidney dialysis, we do cosmetic surgeries, we do even we have done bypass surgery, we have also implanted stents. So so this hospital, and all this free of cost, either by the corpus that we have created, or the organization that sponsors these subjects to this hospital, refers these subjects to this hospital, they do it. And they sponsor and defray the cost of any treatment that they undergo. And as you know, Cadila also in the Western India, especially in Gujarat, has partnered with Apollo hospitals. So so what we can't do it in that hospital, we also take them to the Apollo chain, and again free of cost. We take care of the money that we spend in this. So this predominantly it has been healthcare and healthcare. In recent times, as I told you, we are actually working on 5 major areas of or 5 spheres of our activities can be classified in 5 verticals. One is the healthcare, which I just talked about through the Kakaba Hospital. The other one is in education and nutrition. What we realize, we have tagged the villages around our campuses. We have around 6 campuses across India, so we have tagged around 98 odd villages around these campuses. But currently we are working here in Bhat, as well as in Dolka and in Hansot, in Uttaraj villages in Hansot, 3 or 4 major villages which is surrounding our major campuses, wherein we in recent times we have been upgrading the school infrastructure of the government schools in these villages. For example, in Bhat village here, which is next door, they had only a primary section, so we brought them up to 10th grade, and from this coming year we are the school management has applied for 11th and 12th classes also of the state board. So we are adding classrooms, and we are adding we have also established computer labs in the schools, in which we have done some work. And one thing we realize, quality of teaching is not that good. So what we enlisted organization like Teach India to coach the teachers in these schools. So that is one initiative that has been welcomed, and we have seen some good results. And also, one of the linchpin of our activity CSR, we don't want to just fund some major signature events of the government, state or central. What we do is we sort of act as facilitators, use our funds. Though the 2% requirement is not more than 2.5 crores for us, but for example this year we spent close to 20.5 crores in various activities, and it's basically I call it as seed funding, in the sense any amount, even to visibly do something in one village, is not sufficient. So we have to enlist partners, especially the yojanas of state government and the central government, and that's what in recent times we have been doing. So in the when I said infrastructure, we contribute some amount of the capital, but then most of it through various yojanas of the state government, we have brought those fundings to build. In fact, we have now built a primary school, a separate Pakka primary school, or 5-storied primary school in Bhat village, using the funds of the state government education department. So something similar we are replicating in the other villages that we work also. Anganwadis, we have strengthened a lot of Anganwadis, cleaned up, created good infrastructure for Anganwadis, and more importantly, we realize the dropout in these schools happen because the midday meal is not, though Gujarat state, the midday is relatively better than the other states, but it's very meager. If you ask a child why he doesn't want to come to school, because he's not happy with the food that he gets in the afternoon. So what around 3 years back, we started this, very humbly, we started financing 5 schools, and then today around 38 schools, around close to 20,000 kids on a daily basis get midday meal through Akshaya Patra. We enlisted Akshaya Patra. Akshaya Patra Foundation, provides very good nutritious meal midday meal. So there, any case, Akshay Patra is in Gujarat, is one of the major implementers of Gujarat's midday meal program, and so we enlisted them, and we are financing around 38 schools, around 20,000 students every day. They eat the Akshay Patra food, So that is in the education and the nutrition side. The third area that we work is, addressing one of the Sustainable Development Goals of UN, which is, women health and hygiene and empowerment, women empowerment. So so we call that, we are given a name for that set of activities that we do, called Matru Vandana. It's basically, it is in the memory of our founder chairman's wife. She was also our first employee of Cadila. So she died at the age of 85 in 2015 December, and since then we floated this idea of all the activities that we do related to women and women hygiene and health. So under that banner, we realize rural women, especially rural women of Gujarat, are anemic. Another study says also, cervical cancer goes undetected in the rural settings of this country, especially in Gujarat. So we enlisted Red Cross Society of Gujarat to help us. They are well equipped to screen the rural women and adolescent girls for cervical cancer. So what we have done is, we have enlisted them. We go to all the neighboring villages. We have actually touched base only around 10 villages as of now, wherein they come and do the screening and any aftercare. Because cervical cancer is one such ailment, when detected early, is curable. So we have embarked on that journey, and the idea is similarly anemic. Cadila is blockbuster product since 1951 is Hem-Up and Hem-Up group of products. These products are actually addressed for iron deficiencies and hemoglobin deficiencies for expectant mothers. So we very effectively use these products in our medical camps, multi-special camps, when we detect people, when we screen and find women who are anemic and hemoglobin deficiencies and all those things. We take them to Kakaba Hospital initially, we start the aftercare, and then later on we give a package of medication till it is eradicated in their cases. So that is another major activities. And as far as women livelihood or empowerment, we have established in 4 or 5 of these villages around, now I think it's around 6 self-help groups, women self-help groups. Some of them are through Usha Silai schools. We have trained one of the groups tailoring skills, and given some tailoring machines, including getting some market linkages from Usha Silai school itself. They do a lot of work. One area, especially in this locality, in Dolka Taluka, Dolka is known for a handicraft called Katla Bharat. And that's the market where this embroidery wholesale market exists. So we brought some experts from the wholesale market. We trained some of these women in the various self-help groups, and today some of them, especially in the Bhat village, I have just recently interacted with some of them. They are all making average around 10,000 rupees, which they were not earning. They do phenomenal embroidery works for sari falls and for salwar kameezes and things like the phenomenal work. And also in one of the villages in Uttaraj in the Bharuch district, there we also we started a small unit for making sanitary napkins. And now that thanks to volunteering from our PAC FND, they have developed the packaging also. So today they are able to sell a lot of to the neighborhood, to the hospitals, to the local markets. They're selling these sanitary napkins. So they're doing. So we are trying to replicate that also in some of the villages here in Dolka and Bhat and in Hirapur. So so these are the various activities that we are doing as far as Matruvandana is concerned. One of the signature events, activities under Matruvandana is we on a regular basis, especially in Samba, in Jammu Kashmir, where we have our manufacturing, domestic manufacturing. There, we initiated this program called, of supporting, widows of armed forces martyrs. So we give them training, vocational training. We give them medication, healthcare, and that is picking up very well, and it's being appreciated. And we work now very closely with the welfare societies of the armed forces themselves, and doing a lot of good work there. So that is Matruvandana. The fourth is we have been doing a lot of rural activities, in rural development activities in the villages. Then we realized, we have a very good example in Punsari Gaon in Banaskantha district. Himanshu Patel, he is Sarpanch who actually converted his most impoverished village into this artist village, and he is globally recognized for transforming Punsari. So we are trying to replicate that Punsari example in the villages in these two talukas, Dolka and Daskorai talukas. Very recently, in the month of October, what we did was we invited him. He has now an organization around him, along with an NGO called Know Your Rights Foundation, Lipi Khanda of Know Your Right Foundation. What they have done, they have developed an app which actually enlists all the yojanas of the state government as well as the central government related to rural development, village management, and a whole lot of things, livelihood projects in the rural settings. So, so what we have done is, in October we called 100 villages. There are 100 villages in these two talukas. We brought them we have enlisted them and made them members of the app. They downloaded, and what we are currently doing, by maybe mid-January, we would have done the gap surveys, gap and need surveys for all these villages. We created clusters of 4 or 5 villages based on their proximity, and they are all linked to a call center. So anything that is identified as gaps or need of a particular village, we would be acting like facilitators with the relevant the government programs, and bring those, help facilitate them to write projects for their villages, and bring those departments and fundings to their villages to sort of solve their local problems. So that is something that we are very excited. That is something that we have just embarked. It is all the 100 odd sarpanchas and talatis who have been hooked on to this call center. They are all very actively participating. So it looks like that by February we should be starting, helping these villages to bring all the government yojanas. The success story of Punsari would start rolling, I would say, literally from February this year, coming year, 2020. That is the rural side. And the environment, and the fifth area that we work is on the environment and enriching the environment. So what we have done for a long time, Gujarat state government has been giving 100% subsidies for establishing village talavs, water bodies, village ponds and things like that. So we have been over the years, I would say, because we are also in the agriculture side of the business, so we have been working with a lot of village and taluka development officers when we have enriched 2 very big lakes which were actually polluted and very all the wastages of those villages used to be dumped there. We have re-energized 2 very good lakes. Now they are in the Dolka taluka. These 2 lakes have been very nicely enriched, and we are adding a lot of talavs across the villages. We are putting up a lot of talavs, and then the green cover, every monsoon state government also runs this Vanutsavs. So we also participate. We used to also do planting. You see, all our campuses are green, but we have replicated this in all the neighborhood villages. What we do is to sustain these plantings, what we have done is it is around the schools, around the panchayat office, primary health centers and other major government setups, so that there is somebody who is accountable and who nurtures these plantings, especially in the schools. Especially we experimenting, piloting in the Bard school, where on their birthdays the kids have to plant a tree, and then we also label it that it was planted by the child. So there is an incentive for the child to nurture those plants. As a result, I see 100% what should I say, the plantings which they do is surviving, and if it's not surviving, they replant it. So as a result, it has become very green. The school is surrounded by a lot of greenery now. So that is the kind of thing that we are trying to inculcate across our campuses as well as the villages surrounding our campuses. So there are a lot of green cover. As such, this is a rural setting, beautiful green setting, but we added a little more color to the settings around us. So that is the fifth area that we have worked. See, the 17th Sustainable Development Goals, SDG, is partnership. Though it talks about partnership globally between countries, at the grassroots level, we believe in partnerships with the local bodies, NGOs, and we have, in recent times, we have very effectively used these partnerships. Not just government. You please understand. We even though we spend, for example, just Cadila and its other trusts, family trusts, we every year spend around 100 crores of rupees in CSR activities. But believe me, 100 crore is not sufficient for even one village, one BART village. Generally, anything, if you want to see a large-scale transformation, you require the government and other like-minded people to be investing in the sustainable goals, sustainable development goals. So so in recent time we realize this money that we have, it's also fairly big sum of monies, but we realize if it is effectively used as a seed capital rather than as money being spent for any initiative, we use it as a seed capital and bring to play the government yojanas for the various things that we do. As a result, we started realizing and that we are able to scale up. We are using these NGOs and government bodies and government yojanas for scaling up the activities that we are doing. What we do doing in few villages, we are now embarked on a journey of actually using the government resources and NGOs and foundations to scale it up for much larger good. We always believed from day one, and the reason why we established was we believe in preventive rather than curative. If you really want to have a sustainable model in the healthcare and pharmaceutical, basically the Cadila's approach has been and should be it should be preventive rather than curative. So that's why most of our recent preoccupation is we are working a lot. We invested a lot in vaccine research. So we have in the coming years there are a lot of good vaccines that are being launched, and that's because vaccines which will form part of the immunization program. So prevention is better than cure is what is our punchline and our chairman's lifelong mission. So so we believe in preventive rather than curative. See, basically what we realize that most of the though Gujarat is relatively better than most of the other states, but we realize the government schools and the rural schools are very limited. infrastructure wise. And to address that, we embarked on, initially our activities related to education and nutrition was rural education and nutrition was to strengthen the infrastructures by adding classrooms, by adding other visual aids and teaching aids, and like creating libraries in these schools. But now what we recently, around 2-3 years back, we also we took over a education trust in Kadi in Gujarat, Kadi district of Gujarat, where the idea is it was running colleges actually. So now we are also backward integrated. We are also going to get into setting up schools, good schools, maybe humbly firstly in the Kadi district itself, and then span out into the length and breadth of the state, and then maybe if God willing, we would also take the schooling to other parts of the country. But the idea is to give a holistic learning experience for the kids right from the kindergarten till post-graduation and PhDs. In fact, in our college we are already doing undergraduate and graduate programs. We are inducted a lot of research scholars doing their PhD studies and research. So that is been our humble foray into education. Initially, we are running these colleges, engineering colleges and biotech colleges, but the idea is to go across the state, set up from primary schooling. We want to set up. The idea is to have a wholesome learning experience in rural settings in Gujarat at least. Oh, in fact, most of our, as I told you, the punchline of our founder chairman, whoever has met him and worked with him, he always believed that innovation is all about making the medicines affordable to the last man in the society. So so his life-consuming mission was that. So we do a lot of. Cadila is known. In fact, he is the only Indian pharma company which does a lot of innovative research, and most of our research are towards making medicines or whatever products that we come out with affordable, of the highest quality. So and the same holds good in the other related business that we do in agriculture and whole lot of things. So a lot of innovations that we have done, especially one of the sustainable goals for agriculture is to protect environment and do sustainable agriculture. So Cadila were pioneers in biofertilizers. Our product lines are in the agriculture side. We are more in the input side. Most of, instead of India, especially India, progressive states like Orissa and others, they are all moving towards organic farming. And we were pioneers in that, in providing biofertilizers or organic fertilizers. So similarly in the healthcare side, most of our innovations revolves around for example, one of the best known innovations is find one drug for any cardiovascular disease. So cardiovascular diseases are like diabetes, blood pressure problems, cholesterol problems. Somebody who is afflicted by any of these diseases, in a day they consume 4 or 5 tablets or capsules. Cadila innovated and brought Polycap. Polycap is a capsule which has 5 drugs in one capsule. So it is equally good for diabetes or for blood sugar or for or cholesterol. So so that kind of innovations. What typically somebody who is afflicted by any of these diseases, a blood pressure problem or cholesterol problem or diabetes, they can consume around 45 rupees worth of medicines every day. By substituting it with one drug, it is not even 9 rupees a drug, you know. So we always, our innovations or our research work has whole around or been related to how we can make medicines affordable to the last man in the society. So it is a good example, I would say, Polycab. Yeah. In fact, from day one, after it was implemented, the SDG, the agenda for sustainable development in January 2016, India also is a signatory through Niti Aayog. We, in our own way, humble way, we realize and we believe that at the micro level, at the grassroots level, organizations like Cadila has to play a role in the achievement of the agenda of sustainable development by 2030. And so most of our initiatives, CSR initiatives in recent times, especially from 2016, it relates to one of those 163 odd targets that UN has enlisted to be achieved by 2030. So most of our programs are hovering around these sustainable development goals. So you see, for example, healthcare, it is the sustainable development number 3, SDG 3 is what it relates to. SDG 7 talks about, not SDG 7, SDG 5 talks about women empowerment, women hygiene and health. That's where the Matru Vandana initiatives and programs revolve around. So we basically, we are trying to align our activities to these sustainable goals, 17 sustainable goals, and around 163 targets within these 17 sustainable goals. Most of our programs correlate or relate to these development goals. One very important, rather the only criteria that we choose is, these are initiatives that we have been doing at a smaller scale. Our main reasons for enlisting NGOs and implementing partners is to scale it up and to help us find relevant volunteers to implement these the initiatives of ours at much larger scale. So one such example is we enlisted the Akshaya Patra Foundation because they have state-of-the-art kitchen and state-of-the-art logistics for taking food for 20,000 odd kids across a few districts of Gujarat. So that was the criteria, because nobody else has that kind of logistics and kitchen facilities like Akshaya Patra. So that was the consideration. And then projects like training for tailoring and all. Usha Silai machine has Usha Silai school rather has the Blind Men's Association of Ahmedabad. So they are the implementing partners. So because I wanted the self-help groups to be trained in tailoring and embroidery skills and things like that. So I chose Usha Silai school because they are very organized. And so these are the major reasons or criteria on which we choose partner. Based on the initiative, relevance of the initiative, the NGOs come into play. And we have still not embarked on scaling up some of these initiatives, but in the near future, like ICICI Foundation, which is the largest CSR foundation in the country, we wish to sort of enlist them for microfinancing some of these self-help groups for the various things that they do in the villages, for financing those projects or programs, So that is the criteria. So we are not very structured. Depending on what initiative we have embarked on, who is the relevant partner, whether he has or the organization, institution that we enlist, whether they have the ability to execute at a much larger scale. That is the criteria, underlying criteria on which we select these agencies.
So, Corporate social responsibility.
Kakaba Hospital.
Sustainability.
Sustainability is our activities in our tea estate in south of India. We have a program of what we call the pink toilets. It is well maintained by the workers in the tea estate.
Social impact.
Social impact, I would say at this point in time we are too early. In Kakaba Hospital itself, that's what comes to my mind. It has really impacted the healthcare scenario in the surrounding districts of the hospital.
Philanthropy.
Philanthropy, Sri I.A. Modi, our chairman. See, frankly, for us, CSR is way of life. So there is no question of how far we have come or far. It is everyday life is as relevant as breathing. So for us Cadilians, especially for somebody like me who has spent 23 plus years in Cadila, I have seen and worked very closely with our founder chairman. It's way of life. Frankly, I don't want to measure it that I have come thus far and I want to go this far. Continue to do what we have been doing. These are all good initiatives. These are all initiatives which are very relevant for today's times, and definitely we will always want to be seen as work in progress, so that we are totally engaged and committed, and continue to be committed and not bring in any amount of complacency in the activities that we do. We will continue to nurture it because it's for us, it's way of life.